Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it over to you. Every second citizen in Denmark is sick. And this sickness is often chronic. So this is a sickness, physical or mental, the patient has for years, often for a lifetime. The doctors are not really able to help these patients. They are frequently visiting the doctor, and every second day is regularly taking drugs for some health problem. But as these diseases are continuing year after year, it is obvious that something is wrong with the medicine. We are not curing the patients. And this is not because medicine is unable to cure patients. It's because Danish doctors, they believe in drugs for, so to speak, all kind of problems. And drugs are often little helpful when it comes to chronic disease. As a rule, if you have a chronic disease, drugs are not helpful. So, if you're giving drugs to chronic disease, you know that your likelihood of having a good result is 1 in 20 or less. The question is, why aren't doctors using alternative methods, which are as scientific as drugs, or even more scientific, if drugs are not helping? And the reason is that they are not trained to do so. The academic medicine in Denmark delivers doctors that are not able to do much more than giving drugs to patients. And it is in the way a doctor is paid in Denmark, that you are paid according to the prescriptions and the drug you're giving. So if you're talking to the patient and you using the classical methods, it's difficult to get a good salary even. So the whole system is set up to drugs and to use drugs as medicine. In this article in the British Medical Journal, we argue that we need to change the way doctors are trained, because we need doctors to be able to use a wider range of tools to help patients, especially when drugs are not working.